So this is a brief introduction to what we know as of early August 2021 about what's happening in the Sustainable Health Review implementation with regards to recommendation 2A, which in summary relates to halting the rise in obesity. What you see on the screen now is an overview of all of the enduring strategies and recommendations, and you can see that recommendation 2A is part of enduring strategy 1, which is about committing and collaborating to address major public health issues. And the full details of that recommendation are to halt the rise in obesity in WA by 2024 and have the highest percentage of population with a healthy weight of all states in Australia by July 2029. Now, we note that many of the recommendations in the Sustainable Health Review, the implementation has been a bit delayed because of COVID and other issues. So I don't know if the intention is to change that timeline that's in the Sustainable Health Review, but I know, for example, that some of the things that might have been planned to have been further ahead are in fact still underway. So we don't know at the moment whether or not that timeline for those key milestones is likely to change. This is just the rest of the strategies and recommendations. But briefly, we had a presentation run by the Chronic Disease Prevention Director at the Department of Health, who outlined the priorities for recommendation 2A relating to the halt in the rise of obesity. They talk about a state obesity action plan, and it was outlined that that action plan will in fact cover right the way through from primary prevention through to early intervention and management. And you can see the rest there. We've got getting junk food and drink ads off state premises, healthy food policies across state agencies, changes to planning laws to limit junk food outlets and support access to healthy food options, and support for proven reforms at a national level. And so the work that is happening on this nationally is that there is, and has been for some time, I think it's about 3 years now, there's been a consultation process relating to a national obesity strategy. And there's also a similar amount of consultation being done on a national preventive health strategy, which also refers to obesity. So it's fair to say there's an awful lot of work being done in the planning in this area. And what we're going to try to do to the best of our ability is give some idea of what that might end up looking like in practice, noting that so much of this work is still at that planning and consultation stage. I want to focus on one of the particular areas, which is the state obesity plan that is referred to as one of the key priorities. I had the opportunity to chat with the team at the Health Department, and my understanding is that the plan is to draw on 2 key documents that already exist. One is, and I'll touch on it briefly, the WA Healthy Weight Action Plan, which Health Consumers Council is a steward of alongside the Health Department and the WA Primary Health Alliance. And the other is the WA Health Promotion Strategic Framework, which, as you can see on the screen, is due to end in 2021. But there are plans now, and that is they're starting for that to be under review with an intention for that to be brought up to date for the next 5 years. When speaking to the team at the department, their approach is to draw on quite a lot of the consultation and engagement work that has already happened. So on the Healthy Weight Action Plan, there's been consumer participation and input to that plan since before the plan was developed, so for over 3 years. And on the WA Health Promotion Strategic Framework, I believe the plan is that a consultation plan is being developed for that. In terms of some of the practical things that consumers might expect to see under the Healthy Weight Action Plan, there are some initiatives being explored to look at new innovative approaches. One of the key things that was identified through engagement with health professionals as well as with consumers is that there is in fact a dearth, an absence of a range of services that people who might be dealing with overweight and obesity and the health impacts of that to be referred to. So Diabetes WA were funded to trial a total meal replacement programme, and that is reaching the end of its first wave of input. It's also been funded, Curtin University received some funding to develop some quality criteria and outcomes-based framework, noting that while there are a gap in the number of services that are available, there is in fact a breadth of potential approaches in this area, and the aim was to come up with a set of criteria where health professionals, commissioners and ultimately consumers can make informed decisions about what might work for them. You can see there on the screen that we have developed a Shift Media Guide, which here at Health Consumers Council we've used a number of times already to help to address weight stigma. I have to say, since getting involved in this programme, I've begun to learn that actually the impact of weight stigma is in some cases more damaging than the health impacts of being overweight or having obesity. It's not to say that's the case for everyone, but it is fair to say that the health impacts of weight stigma are really only beginning to be fully understood and appreciated. And so changing the narrative and tackling weight stigma both in the public and in health services is a real priority for Health Consumers Council. It was noted in the Healthy Weight Action Plan that there's a limited understanding amongst health professionals of the latest evidence about treatment for overweight and obesity, and often many people experience that they are given a version of eat less or move more, noting that while that might be fine advice, that it's likely that the person is probably aware of that already, and what the person might need is, what does that mean for them in their context and with their health issues? And so there's workforce development work being done by East Metro, who've developed an online education programme, and also by the WA Primary Health Alliance in partnership with Diabetes WA to upskill and educate GPs about that. So in terms of what people might experience differently, what we would hope is that soon we might know that there are consumers who've gone along perhaps to see a GP, or they've been referred to a clinician who is perhaps drawing on some of the information that they've learned about how to talk about weight, how to treat weight, and that might be different. In terms of the WA Health Promotion Strategic Framework, I just had a quick look at the current version, and this is, there's exactly what you might expect from such a framework. The priorities are healthy eating, a more active WA, curbing the rise in overweight and obesity, making smoking history, and reducing harmful levels of alcohol use and preventing injury and promoting safer communities. Just one thing that I think that Health Consumers Council would add to that discussion is the often conflation that happens between the first two and the third one there on that list. So often it's understood that healthy eating and physical activity are the best interventions for overweight and obesity. I've had the privilege of being able to understand a little bit more about some of the evidence in this area, and I think that there is a risk that we fall back on those two because they are the ones that are easy to talk about, and we would be hoping to see that the WA Health Promotion Strategic Framework would also extend into some of the other more prevalent social determinants of health that might also have an impact on people's health and well-being. You can see that in the target groups, people living in low socioeconomic circumstances are identified as a target audience. But I think what we would like to see is still be quite interesting to see what specific work is being done in that area, noting that it is a hard, it's a hard issue to tackle. And then in the domains for action, you can see that the kind of scope of that framework is about policies and legislation, creating public awareness and supportive environments, and as well as some targeted intervention. But there's a lot, if you like, on that kind of creating the policy and physical environment where it's easier to make healthy choices. So in terms of what's possible and around consumer partnership in this recommendation, I would say that what's actually happening at the moment is Health Consumers Council, up until September this year, is a very close partner with the Department of Health and WA Primary Health Alliance on the Healthy Weight Action Plan, and we're looking forward to hearing what will happen next. That we continue to provide feedback based on the consumer perspective that we've already heard about into key activities relating to future chronic disease prevention programmes. And we have offered our support to the Chronic Disease Prevention Directorate in regards to the governance of this recommendation. I think in terms of the potential, that there is the potential for more consumer involvement in that RIC2 working group, that we could be holding targeted focus groups on particular issues and with particular groups. And there's still more opportunity for us at Health Consumers Council and consumer leaders, community members to provide feedback on draft frameworks and documents. In terms of likely practical changes from this recommendation that people might notice on the ground, I'm hoping that Health Consumers Council will be continuing to promote, and there is definitely interest from our partners in having a centralised point of information on current services and programmes, and that would be continually updated as new programmes come on board. That we would start to see increased capacity in health services for a more holistic obesity treatment service for people who are impacted by severe obesity. Elsewhere in Australia, they do have specialist obesity clinics, and that's not something that is widely accessible here in Western Australia. For example, access to bariatric surgery is only possible in one public health service, and there's a really significant waiting list for that. So we would like to see more capacity in more contemporary treatments in this area. And we'd like there to see that we might move towards seeing specialist clinicians in primary, community and hospital services who would have an enhanced understanding of the clinical evidence in the treatment for overweight and obesity, and would be able to talk to and looking both the role of disordered eating, mental health, physical nutrition, physical activity and sleep, amongst many other things. In terms of our interest around the health promotion strategic framework, we would be advocating that any public health campaigns do not contribute to weight stigma, and so that consideration is given to imagery that is used, that public health campaigns go beyond eat less and move more, that public health campaigns and activities recognise that nutrition and physical activity are only two of the many factors that impact on somebody's weight and health, and also that we see an increased focus on the social determinants of health and a willingness to move away from doing what we can do to doing what needs to be done, which is how I heard it mentioned at a recent National Obesity Society conference. So in a very rapid nutshell, that's what's happening in recommendation 2A.